Welcome to Age in Place Health. I'm talking about PACE healthcare and what makes it so different and life-changing for many seniors, older adults, and people 55 and older. So what is PACE? PACE is a healthcare program specifically for people who have 1, 2, 3, or more medical conditions. PACE takes an all-encompassing view of life. That's why PACE coordinates and manages every single medical need, so everything's easier. PACE has a great social center where people can enjoy new activities and have a good day out of the house. PACE also helps at home with personal care aids so people can live safely in their own home. And of course, there are van drivers to take people to doctor's appointments and the PACE Social Center. Van drivers are some of the most loved people at PACE. The goal is for people to live well and safely at home for years to come. By the way, the word PACE comes from Program of All-Inclusive Care for the Elderly, but it's for people 55 plus. Now, why does PACE exist? The goal is simple yet profound: to enhance the quality of life for older adults. PACE reduces emergency room visits, reduces time in rehabilitation hospitals, and reduces the likelihood of someone having to be in a nursing home in the future. So this means more time doing things that people love where they want to be. How do you know if PACE is right for someone? Well, if I were speaking directly to an older adult, I'd ask questions like, are you managing multiple medications? Is that like a bit much? Are you not driving anymore? Are there so many doctor's appointments and it's not easy to get to them? Have some of your everyday routines become a little more difficult? Those might be signals that a person wants to consider PACE. And PACE offers a lot. What does the person need? Do they need hearing aids that are adjusted to their liking? Do they need dental work, crowns, dentures, bridges? Maybe they're living with diabetes and need regular attention to their feet, dialysis, and nutritional counseling. Maybe it's time for a new pair of glasses, or someone's feeling melancholy and wants to talk to someone about it. See, PACE covers all medical needs, so there's never a question of what's included. The PACE Center is a hub of activity. So imagine a place where a person can choose to join in 4 or 5 activities, get to know a regular group of people, have a healthy lunch. There's also a senior gym where people can exercise with a physical therapist and occupational therapist. And there's also a clinic where the nurses and doctors are for regular checkups or if someone's not feeling well. I visit a lot of PACE centers, and each one has something very special about it. Medical care in PACE is very high quality with a personal touch. Doctors and nurses in PACE are specialized in caring for older adults. They have fewer patients, which means they can spend more time with each person. Imagine having time with a doctor and nurse instead of just like a quick 15-minute visit that somehow takes all day. The doctors and nurses at PACE really get to know their participants. PACE also gives people access to a full team of specialists, from cardiologists to psychiatrists. PACE makes sure each person sees the specialist they need to see. PACE makes all the appointments and brings people to the appointments. Each of these specialists is coordinated with the PACE doctor and nurse. Everyone's on the same team. Everyone's up to date on what's going on. What does PACE cost? Well, nothing for people who meet the income and asset limits. And for people over the limits, they generally pay the difference between the Medicaid income limit and their current income. There's also an asset limit, which varies from $2,000 to unlimited, depending on the state. Check out our ebook, okay? PACE is a Medicare and Medicaid program, but it's not what people expect from a Medicaid program. Lots of people pay privately for PACE, thousands of dollars, because it's worth it for them to be able to live independently and not in a nursing home. There's quite a few ways to make the finances work out, even if one is over the limits. I'm happy to speak to people individually about what they might ask an attorney or ask a Medicaid counselor about. PACE is a Medicare and Medicaid benefit, so it acts as a full insurance plan. When someone has PACE, they don't need a separate dental plan or vision plan or a prescription discount plan. PACE includes all the healthcare services a person needs, all of it. There is no copay that comes out of pocket for a prescription or for a visit or for a service. There's no annual deductible, zero deductible, okay? PACE is complete healthcare for older adults. The goal is to manage health conditions and provide great preventative care and support so people can live at home independently and with dignity. Live at home, not a facility. That's what I say.